Okay, sorry about that. That was my secretary, and I don't want to upset her because that will make my life very miserable. She's a very good secretary. Um, Anyways, what I was saying about pain is there's going to be those who they're to fool us or this or that, whatever. But there's always going to be a cause, and don't ever underestimate that there's an undiagnosed physiological cause, but especially don't underestimate the possibility of a psychiatric cause. Okay, depression uh, can and other mental illnesses can easily be the sources of this type of behavior, and treating them can easily correct the behavior. Okay, so that's that on the discussion board. If you feel like you want a little more feedback on your own individual post, let me know. I'll be free. I'll be happy to give you a little bit more if that's not enough for you. Quiz 4 and 5 are going to be consolidated into one quiz that'll be posted Friday. It'll be open until next Saturday or something like that. Um, there are the two biggest chapters are probably skin and gastrointestinal. Think of things that you're going to see on a daily basis as a primary care provider, and actually a lot of them are the same things that I see as an acute provider. Skin conditions, oh my gosh, you're going to see them all the time. I don't know if you've taken pathophysiology yet, but good luck on that section. I hate it. Um, when it comes to skin, uh, everyone always tells me if it's wet, dry it. If it's dry, wet it. And whatever you do, don't touch it without gloves. And that part's true. I use a lot of steroids. I try to determine what things might actually be fungal skin infections and treat those appropriately. And believe me, steroids will make those worse, which sometimes tells me it's a fungal infection. Uh, I am never afraid to consult a dermatologist. Skin is a very tricky thing and is not my strong point. Uh, but there are very basic things that we can do for lots of skin things, and especially some of the things you're going to be treating, like acne, rosacea, seborrhea, those sorts of things. So be familiar with all of that stuff. There's a little bit of some objectives that are posted on the module. These will basically be the meat of what I'm going to select questions for the quiz. Gastrointestinal is another thing: nausea, vomiting, diarrhea, Crohn's disease, ulcerative colitis, irritable bowel syndrome, constipation. There's a million commercials on TV right now about how to fix your bowels, blah blah blah. Xifaxin is a really popular commercial right now with that little set of intestines walking around. And don't worry, Xifaxin is actually not on your examination. That's something you can read up on for your own. I actually use it a lot. Um, in fact, I think that sounds like a good bonus question. Now that I mention it, uh, I'll post this as a discussion board for bonus of what things we might use Xifaxin for and how we might use them because you may find it useful. Anyways, that's a whole nother story. Uh, Neoplasms, I'm not so worried much about that. Even in my practice, I discover lots of neoplasms, but I do not treat them. You must be an oncologist to treat these things, and the same thing is true even in your practice. But I do deal with the side effects of treatments for cancers quite a bit. Lots of patients coming in with hyperemesis, with pain issues, constipation, things like that, and those things we can't treat. So not too much out of that chapter that I'm really concerned about, except for maybe treatments of nausea, vomiting, constipation, diarrhea, things like that. Bones, joints, really talking about arthritis, osteoarthritis, rheumatoid arthritis. Um, Lots of the rheumatoid medications are immunosuppressants, so just be careful when prescribing those things. It's very good to have your patient see a rheumatologist if possible, but if you're in a situation like mine, you are the rheumatologist, so be familiar with those medications. Also, eyes and ears, talking about otitis externa, otitis media, things like that. You're going to see a ton of it. Uh, Antibiotic treatments, I don't really want to go over a whole lot of antibiotics in this quiz because we've already done antibiotics. However, when you're treating skin infections, gastrointestinal infections, ear infections, eye infections, things like that, you're going to have some antibiotics. For this section, I'm particularly more interested in topical antibiotics, odic or ophthalmic solutions or gels, things like that. That's all outlined in the objectives. At any rate, you're all going to do well on that quiz. I know you will. Everyone's done well so far. This material is what I consider to be a bit easier than what we've gone over in the past. We don't have enough time in the semester for the way the syllabus is lined out. Now, the problem is all the information is important. I'm having a dilemma. I don't want to cut anything out, but at the same time, I don't want to start piling more information onto the test if I can, or the quizzes if I can avoid it. But to be fair to you, to make sure that you get all the information that you need, I think probably what we will do is consolidate some of these things. The quizzes may have more information on them, but you will have more time to take them. And I think that would probably be the most fair thing to you. Remember, when taking quizzes, I thought about this the other day. Somebody was saying something about how a course that they're taking at another university, they didn't feel that the quizzes were hard enough for them. And this was a graduate student, and I told that person, I said, well, you can't judge what you know or don't know on a quiz. That's simply a small sample of the information that you may or may not know at that time. It's not comprehensive. You may know one section of diseases and pathologies and treatments like the back of your hand, that the quiz may only ask 2 questions about that section. That doesn't prove that you don't know what you're talking about. So anyways, moral of the story is I'm not going to short you on your quizzes by adding more stuff, nor am I going to make them ginormous quizzes. We all have a personal responsibility to study on our own. Even I, as a practitioner, I study every day. Things that I've learned in the past, I refresh myself on. Things that are new, I learned. Okay, I think I'm starting to babble. I don't think there's anything else really to go over with you right now. I think I would like to get back on track with the video lectures starting for next week. I think I'll be able to get those recorded probably tomorrow or the next day and have them ready for next week. Anyways, keep your chins up. You're all doing a great job. That's really about it. So if anybody has any questions, comments, concerns, let me know as usual. I do appreciate the fact that we've had this kind of lull and people have not been blowing me up with extreme concern. That tells me you have a little bit of confidence in what's going on, and I do appreciate that. So hopefully the course is still going well for you and your schedules. Like I say, if you're running into anything, let me know. Oh, I will leave the quiz. It will have 2 attempts on it. Only take the second attempt if you get kicked off, okay? And remember, I know the difference. And then if you, for whatever reason, you need a 3rd attempt, of course, just contact me and let me know. So, all right, y'all. Good luck to you. It's incredible fall weather out there. It's the worst part about fall semesters because it's beautiful. Do take some time to sit outside and have a cup of coffee or hot chocolate. It's great. All right, I'll see y'all later.